Okay, guys, I wanted to show you our DSM-5. This is like our Bible for therapists. This is what we use to diagnose people with. As you can tell, it's pretty big, it's pretty heavy, and it's pretty comprehensive. Each diagnosis is in here, along with the criteria to diagnose somebody with, along with like environmental factors and a deeper digging into the diagnosis criteria. It's actually pretty great to be able to have a tool like that. But what I wanted to talk about is some instances where we have to look at some extra things, and one in particular for females with that. So we have to make sure that substance abuse is not triggering a mental diagnosis. We also have to make sure a life event is not triggering a mental diagnosis, because that's just a life event and it should eventually go away. And thirdly, we need to make sure there's no medical issues that are playing into your diagnoses. And of course, then you go to a doctor to have that really rolled out. But I wanted to talk about females and diagnoses when it comes to aging. We have hormones that are a bit more complicated than the male hormone of just testosterone that has to be looked at as we age. And I think it's even as young as in our 20s, we should be getting this looked at, and we should actually be having a trend being kept on our hormones, so that when we have increased anxiety, mood irritability, and depression, we can kind of see, is our hormones playing into that? Right now, I just don't think we have enough of a push within our society to do personalized medicine and to really look at hormones for females at a more in-depth level than just, here's the range of your blood work, and if you're in that range, you're fine. But what if you're on the low end of that range, or even in the middle end of that range? We're not optimizing our bodies. And for women, that can create havoc for us, because everything can increase: our depression, our anxiety, our irritable mood, PMS symptoms. And then we're going to doctors or therapists, and they're not looking at that, and they're putting you on anxiety medication or depression medication. And it's just not okay at all. So if you're out there going to see a therapist, make sure they're looking at this. They obviously can't run the test or, inquire for you to get the test from a lab, but your doctor can. And if your doctor doesn't want to do that, then go see a hormone therapist, because it's really important that we aren't being diagnosed and being put on medication as females for things that we don't need to be on, just because our hormones are out of whack and our hormones just decrease on a natural basis. Dr. Drew has a really good episode with his wife on this, where she goes into her own description of her own kind of battle in trying to figure out what was going on with her. For me, I just noticed an increase anxiety, depression, and irritable mood and PMS symptoms that I knew were not normal. And my regular doctor just kind of blew it off. I was on the scale, it's not a big deal. But it wasn't until I went to a hormone doctor and she really sat down and discussed the different hormones and where they should be and how we should optimize them, and then that I got put on the right medication, that it was just so much better for me. So again, if you're a female, go see a hormone doctor. Let's really push in society for personalized medicine, not just for females, but for males, because our bodies are complex, our minds are complex, and we really need a holistic view of everything so we can optimize who we need to be. And it shouldn't cost so much money to do so, and shouldn't just be there for the people who can afford it. It should be there for everybody. I hope everybody has a great day.